the centers. I am not seeing, okay, I've seen one tamale, takrade. Please, is it that they don't know we have a class this morning, or some of the centers have not joined yet? I am not seeing Asanko. Asanko people, are you here? Asankregwa. Okay, I've seen one. All right. Um, I'm sure the rest will join because on at least I have over 270 people on the Telegram page, and some are asking, where is the link? Meanwhile, the link has been shared with us all. Same link has been shared with us all. Okay, so please, those who are yet to join, please do join. Okay. The reps. I want to know the reps. So please type your name. I only know of Caleb, who is the Kumasi Center rep. I don't know the others. So please type your name and then your center for me, aside Kumasi. So type your name, your full name, and then add your center, and then add rep. Okay. So maybe Caleb, I don't even know his surname. Okay. So I have Rebecca, Ezonam, Akpa, Keta, Alexandra Boachi, Kufoidia, Christopher Kumasi, and Sewe J also Kumasi. The center reps, not everybody. Please, I only want the center reps. I don't think the centers you have that many reps. Kumasi, how many reps? Hey. Okay. Andrews, please, are you the rep? Andrews Aka, Takrade. Oh, okay. Caleb, you are not Kumasi, you are rather Takrade. Sure, that's fine. Okay, okay. I thought you were Kumasi. Forgive me. And Tanimu Salifu. Wow. Who is the Tamale? Look, okay. And then Kofoidia. All right. David, assistant rep. Okay, okay. All right. Madam Olivia dear, are you a rep from Koforidua? You've typed your name. I've seen Alexandra. Are you the assistant rep? Please, I am not sharing anything, so you cannot see anything. I'm only speaking, okay? When I share something, you will definitely see it. All right, great. Okay, so I am taking you for two courses. Um, we'll do a little bit of an introduction today for both courses. Uh, I I wasn't so clear lectures will start this weekend, and so yesterday where I was, I couldn't um join, and so that's why we did not meet yesterday. But today we will use the period to we'll use the period to um take to have some introduction. Yes. So basically we'll start the introduction today, and then next week, God willing, on Friday and Saturday, we will have the lectures starting fully. So the first thing I usually would do is to have an introduction. I introduce myself, I introduce the course, because it's important that we understand each other. I am a firm believer that if you are in any relationship and you understand each other, it makes things easy. It will reduce all the frictions that are there. So what we are going to do this morning is to introduce ourselves, which you have started. So we'll do that. We'll do a few ground rules as well so that we know what is expected of us. And then from next week, we can easily um, zoom into what we are supposed to do. So now I am going to share my slides. Um, once, okay. Once I'm sharing, so when I share and you can't see, you draw my attention, please. You should be able to see a PowerPoint slide by now. Please, I hope you can see. I hope you can see. I was just trying to move it. All right. Now, the program you have joined um, is a hybrid program, meaning that you are going to have some lectures online. There are still some talks. You may have some in person, but exam is definitely in person at your various study centers. And so it requires that you do certain things so that you have a successful program. So you are here to pursue almost 2 years degree in nursing. And I am taking you for 2 courses in level 300, the first semester. So I'm going to introduce myself, introduce the course. We'll establish some ground rules and then um, we'll take it from there. So welcome, my Ga people who are here, Ubake, Wezolu. As for the other languages, I'm still learning it. I don't know. I don't think I am one of those who can easily learn languages. And so they teach me and I still forget. But at least these three have stuck. So if you know how to say welcome in any other language apart from the three that I have said, please don't be stingy. Teach all of us so you can go to the chat and then type it there. Okay. Bienvenue, French. Okay. I'm not a French person, but why not? I'm open to learning. So bienvenue to my French people. As a name in Grushi and Mohi. I don't know the language, but I do believe it all means welcome. So thank you. Yes. So a warm welcome to you. Yeah, OBIRIKORANG. My students call me Sister Ya. Some call me Dr. Ya. Some also call me Obaya. Whichever one that you use, I am okay with it. What I don't like is being called an auntie because I am not, even though in my family I am an auntie because I have nieces and nephews. Please, I don't expect my students be calling me auntie or mommy or any of the others. Okay. Zandezua. Yes, I think I remember that one. Okay, so the Mohi is Kobo. I hope I pronounced it well. Good. Now, for the purposes of avoiding distractions and people talking whilst they are not aware that they are talking, I have intentionally, and I will, for all our subsequent meetings, the moment that we get on, I will mute everybody from here. And so whenever you want to speak, you look at the tags bar for the Zoom, you will see reaction, whether you are using a phone, which I don't advise you to, okay, or a tablet, or a laptop, or a desktop. I would advise you to go in for tablets, laptops, desktop. Don't use your phones, please. I know money may be difficult to come by at this moment, but that is the best, that will be the best for you. Don't use your phones, and I'll tell you why. I am saying that don't use your phones. Okay. So anytime you want to speak, all you have to go is to do is that you go to the reactions. Even for some of you, see a hand that has been raised, like what Loretta has done. And then I will ask you to unmute. So Loretta, okay, she has put her hand down, but I was going to ask her so that we all demonstrate. So Linda has raised her hand. Linda, unmute and say hello.
Hello.
Hello. All right. So once she's done, I will mute her back. All right. And then lower the hand again. So now we can all put our hands, lower our hands. Okay. And when it's time to speak, you will do that. You'll be asked to raise your hands and then you lower your hand again. So, like I said earlier, my name is OBIRIKORANG. Please look at how the name has been spelt. It is not Obri and Kran. It's just a single name, OBIRIKORANG. I am very particular about names, especially my name, because this is a given name. Okay. All right. So, I have been teaching in Garden City for the past 13 years, and I've been with them all this while. Uh, let's see. My personal life, I am a faithful follower of Christ. I'm not just a Christian. And so please, um, that's always is shown in how I do my things, how I live, and the way I behave. And so please, I respect all other religions, but because Christ is what I know and Christianity is what I know, I may give examples that is based on my experiences in Christ. And I will ask that the way respect all other religions, you also do respect mine. We will have um a peaceful coexistence like we do enjoy in our country, Ghana. And so I follow the Bible as much as possible. We are human, and so we may make mistakes. If I make a mistake, please, I will be happy if you draw my attention to it, and so that I correct myself. And so, um, I worship at CCC, Calvary Charismatic Center in Kumasi. I'm at the headquarters. We have a lot of churches around, so if you don't have a church to go to, those in Kumasi, you can always come to visit us, and you know the word of God is what will be preached to you, and it will transform your life. I am married, happily married, to one gentleman, and I have three daughters. They are very powerful human beings. I don't say they are little anymore because they are grown. but they are very, very powerful. Um, Sometimes they can ask that I do a quiz because they are happy when I'm marking. But they are very interesting human beings. And they've taught me one thing, patience in this life. Okay, I speak two main languages, English and then Asante Twi. But I understand most of the Akan dialects. So if I find myself in Fantaland and you speak, definitely I would understand you. Ekuapem, Inzima a little bit. I pick up on words easily. All right. A little bit of Ga, just a little bit of Ewe as well. My husband speaks both languages fluently. So I've picked up on a few words, but my main languages are English and then the Asante Tree. So since I am saying it, let me just say one thing that you know that the Asantis they are making noise with. We are saying say kutu, say bam. So please don't be offended. We are all one people, okay? We are all Ghanaians, first of all. But um, if you understand the cultures, it helps you to live your life um, easily and you will not find your, I mean, you don't engage in unnecessary conflicts. The human being first, not the tribe. So I am not tribalistic at all, at all. Um, my favorite food is gobe. And I don't think gobe is a typical Ghanaian food. I mean Ashanti food. So, and the people who makes the best gobe are my people from Eweland. So, if I'm buying gobe, I expect that I see a Davi who is selling it. So, I'm not tribalistic. But whatever you do, we cannot change our tribes. We just have to coexist with each other. So, the fight about it, I am not interested. But I would say kutu, say bam. It's just one of those things. So we take it like that. Okay. All right. So moving on. Um, I've gone through almost all the parts for education. I had my primary schools, junior high, secondary at Santua, so I am an addition and all the additions in the house. If you are here, give me a wave. It's nice to see um the additions as well. If I meet any Santua old girl, I am very happy because we are doing wonderful things. Um, I did my I did 3 degrees at Kenya University. I'm done with another degree at UG. I like learning, unfortunately. Some of us are like that. So I'm even thinking of doing a third one with Garden City. They are introducing a new master's course. Um, I'm thinking, but I just finished this one, so I just want to rest and join later. So I did, yes. So my addition, Marinda, nice to meet you. Which year did you finish? I finished a long time ago. Okay, but it would be nice to know if you are here. So let me know which year you finished. 2013. Wow, that's like 11 years after I completed. Great. I did my undergraduate, which is BSc Nursing in KNUST. We were the first batch in 2003. I did an MPhil also in KNUST in pharmacology, clinical pharmacology. I was also fortunately in the first batch for that course at the Department of Pharmacology. Then that was in 2013. In 2021, I graduated with a PhD in clinical pharmacology as well. So that is my specialty area. And I am done with a master's in nursing from UG as well. So that is my education background. Currently, I'm doing more of research, teaching, and facilitation. Though I do a little bit of clinical work at one or two hospitals within Kumasi. Um, these days, it's not that I don't do that very often because schooling, being a married woman, a mother, and all of that, I mean, takes a toll on one. On yourself. So sometimes you have to shelve certain things. But now that I am done with my program, um, I intend to go back to do some few hours, even if it's just 6 hours or 8 hours in a day. So that's my educational background, and currently I've been teaching. I also facilitate workshops. So if you need anyone to be a facilitator at your facility or hospital, please, why not? Give me a call. I have expertise in supply chain as well. And so anything to do with medications, drug administration, adherence, and all of that, you can easily call on me. Um, so I've been a nurse manager for a ward and for a whole facility in the past years. And like I said, these days I teach most often. My research areas are here. In your final year, you'll be asked to do research. It's going to be part of your, um, what do you call it? um the degree that you'll be awarded. And so please, you would if you want particular faculty members to be your supervisor, you need to know their research area. So I do mostly adherence, medication administration, medication errors, adverse reaction, and those things. My main areas, the conditions, hypertension, diabetes, or cardiovascular in general. So these are my research areas. I have these as my personal philosophy, and I say these to encourage students not to, uh, how do I put it? Not to, I can't boast because I don't have anything. Everything that I have is because God has given me these things. So I don't boast in them, but I do it to inspire students. I do it to encourage students. So the first one, yes, this program is a program that is a hybrid. And so you will be tempted not to pay attention. We've all been there. I know this is personal experience, not people sharing the experience with me. When you are in an online class, it's difficult to pay attention. You are in your home, your comfort zone. Some of you are even at work and you are attending to patients. And I remember when I was teaching the midwives, I called somebody out of the blue, and I asked the person to turn her video on because the kind of noise that was coming, I was like, "Where are you?" She turned her video on, and she was in the labor room delivering a woman whilst listening to the lecture. It's an opportunity to study and work at the same time, but that brings its own responsibilities. So you would need to be responsible whilst you are in the class. pay attention. Because if you pay attention just a little bit, it will go a long way to help you. Be intentional. Yes, be intentional as well. You have to make out time to study. Okay. You have to make out time to study. You have to avoid distractions. And so me, I involve my students. I ask a lot of questions. I usually, because I don't do more clinical work, I will ask that you share your experiences with me. When we discuss maybe a topic, I will ask that you share experiences with me. And so I expect that you pay attention so that when the questions come, you would be able to what, answer. So I don't just tell you, because if I just give it to you and teach you and those things, you forget. You do cheap or pass and forget. But pharmacology is everyday thing that we do as nurses. We administer medications all the time. We ourselves, we take medications all the time. And so we have to make it like an everyday thing. If you understand and apply right from the beginning, trust me, you will not struggle with pharmacology. So I would involve you, because if I involve you, that is when you would learn. And I'm happy I'm taking theories and then pharmacology at the same time. I am going to challenge you when we get to the theories. You would pick a nursing theory and see how you would apply it. We'll talk about that. I'll have to discuss with the reps how the midterm is going to be, and we'll discuss as a class. So once we get there, I would be very happy if you could pick a nursing theory and see how you can apply it to meet the client's needs when it comes to medications or clinical pharmacology in general. Okay. Additionally, one rule that it doesn't matter where you are coming from, so far as you are a human being, I believe this golden rule helps all of us. Whatever you don't want someone to do to you, don't do it to them. For me, it's as simple as that. So if I don't want you to disrespect me, I will not disrespect you. If I don't want you to insult me, I will not insult you. If I don't want you to talk behind my back, I will not do same. Okay. So I expect us to have an open relationship, and then whatever the issues are, bring it up for discussions. That is why we have the Telegram page there. Some of us we tend to be harsh. Yes, it's true. Maybe the person, when they checked on the platform, there were 1,001 messages, and so they couldn't go far and they could not see the link. Somebody asked for the link, and another person would just come in. Didn't you see the link? And start misbehaving all over on the page. Let's respect ourselves on the page. If for some reason you come and you are looking for something, you may have missed it. Be polite and ask, can you reshare? Or please reshare the slides. And since we are using Telegram, you would always, when you go to where the files are, okay, you find the files there. So sometimes you, as the person looking for something, you also have to take that responsibility, take that step and look for it where you know we have told you it will be. Instead of just coming in and you are not polite in asking for something. Share the link. Please, we are not on certain platforms that will be sharing links. This is an educational platform. Okay. All right. Um, and then also, I am a lifelong learner. I always want to learn, and I always learn. I mean, sometimes it amazes me where I pick lessons from, between Kumasi and Accra. And sometimes I drove. And so whilst I'm driving, the behavior of drivers, the behavior of passengers, the behavior of bystanders, even at the rest stops. I learned a lot of it. I learned a lot of lessons from there. Okay. So I am a strong believer that nia onim usua nea odwen sɛ onim dodoɔ no sɛ ogyae sua a ketewa no koraa onim sɛ onim no ɛbɛfiri ne nsa, meaning he who does not know can become knowledgeable from learning. You are here, you are thinking, pharmacology, diploma, the way I struggled, and I've come to meet it here. Hey, you did course registration, you saw biostatistics, and all hell broke loose. Here too, microbiology, you see it next semester, and you are like, here too. Yes, here too. Medicine will come, pedics will come. All of the courses, most of the courses that you did, especially in year 2 and 3, you will see it. Some of you are even shocked. Why anatomy again? Please, these are fundamental courses that as nurses, we need to do to ensure that we have, when we say we are degree nurses, there is a difference. And as you go through the courses, you realize that, oh, yes, there is a difference in what we were taught at the diploma level and what we are being taught now. Yes, we will start with the basics, but definitely there is going to be a huge difference. Okay. And so I encourage you to learn. That is all you can do. Learn. Instead of collecting monies, I'm sure they have told you, please stop it. Stop it. It is not necessary. You collect money, people cannot even pay their fees. And you reps, you force them to collect money so that you go and pay people. Stop it. We've been saying these things. And this year, if you are caught, last year, there were consequences for people. Last semester, I can share with you, I can look for that letter the head of department wrote. If you are caught, trust you me, the consequences can be dire. So please, instead of doing that, just learn. After all, you need 40% to pass. I have taught students in pharmacology who are getting 80 plus. All because they learned, they attended lectures. That is all. So if you think, oh, pharmacology will be hard, hey, God, have mercy. As for God's mercies, they are new every morning. We all get it. Okay? But learn. Because if you would learn, you would know. If you learn, you would know. You only need 40% to pass. 40% to pass. Don't pay any money to anybody. And we are taking care of exam. Nobody asks you to, because the university pays for, when we are coming for exams at the various centers, they pay for what do you call it, our accommodation, feeding, and everything. Don't pay any money to anybody. I am saying it here. Don't buy any book, because we don't sell books. So nobody should come and ask me, Madam, there is no textbook. I will give you the notes. I'll give you textbook, soft copy. These days, why would you carry a whole rank and deal around? How? Please, there's no textbook anywhere. If anybody asks you to buy any textbook, laugh at them. We have our V class. I would explain later. We have our V class. Yes, I'll show you my face next week. Okay. This week, not today. I have to, but you saw my picture. I have not really changed. It's just me. Okay. God willing, on Friday, I'll show you my face. Where I am, the network, I struggled a bit to get to get in. So usually when you turn the videos on, It can take you off. So please don't worry. I will show you my face. Okay, I will show you my face. Um, so please, no, you don't. I will share everything on the Telegram page, all the textbooks you need, notes, everything will be given to you. These days, we are going digital. Eh? Digital. Then you want to remain what? Paper. No. With digital, you can move anywhere. You be in the trotro and you are learning. You be in your washroom doing number two, you are learning. You can learn anywhere at any time. Okay. So please, um, let's learn. That's all you need to do. Then again, the most important thing is that believe in your God. There is one God. That's what my belief tells me. There's one God. Some may have more than one. That is their belief. Okay. That is their belief. But whichever God, okay, whichever God that you have, please believe in Him. For me, if you trust God, there's nothing in this world. The one who created everything, how can He not do anything for you? Okay. I strongly believe that with Him, all things are possible. If you are having challenges believing in a God, I would preach the God of the Bible to you and His Son Jesus Christ to you. If you don't have any, please, He's waiting for you with open arms. Come to Him, okay? But with Him, all things are possible. I am not always a serious person. I have my fun side, and that is this is my fun site. Okay. Um I love music. I listen to all kinds of music. But I especially like high life, old time music. I'm not really a fan of the new songs because I do understand some of the words that they say. But I like old time musicians, Konimo, Kiki Kabobo, Akwaboa. Currently, my all-time favorite, currently, is Kenata. Okay, but I love the Lumbas, the Kwejentris, and those high life people. I'm not a fan of the other. The only rap person I think I like is Sarkodie. The others, I don't hear the words very well. And if I can't appreciate the words, yes, team move, yes. If I can't appreciate the words in the music, I find it difficult to enjoy it. So I love gospel music. You find a lot of them. Usually before if I'm able to join, and I will join the class like 5 minutes before. And so when you come, you see that I may be playing a song, likely to be a gospel song. I watch a lot of movies as well, all kinds of movies except horror movies. I don't like horror movies. And so if you come and share horror movies with me, say, Madam, there's this new movie and it's a horror movie. My brother, my sister, I cannot watch. Okay. But all the other kinds, why not? I watch. And so I'm open to recommendations. Yesterday, somebody uh, recommended I watch a movie. The RIP is an action movie. Though I think the movie ended up watching me instead of me watching the movie because it was a bit late. I play games. My favorite games now, Candy Crush and Scrabble. That's just to unwind. I read a lot. I read anything and everything I get my hands on. If it's readable, why not? Digital, in whichever way. Yes, don't worry. I'll talk about that one. I'm saving it for the last. Mm. Um, so I I read, but my favorite book of all time is the Bible. It's the only book that when you are reading, it is also reading you. Okay. It reads your life and transforms. If you allow it to speak to you, it can transform your life. And I eat everything. One of the things that I enjoy doing is trying new foods. So usually when I visit the centers during exams or anything, when we are sent, I try the traditional food there. And me, which people are called Man United? Do they exist? Hey. Hmm. Anyway, I eat everything, but like I said, my favorite of all time is gobe. As for gobe, it is one meal that if you go anywhere in this Ghana, or maybe even outside Ghana, if the opportunity is there, you will find, and it will still taste nice because cocoa is nice already by itself. The beans, if they cook it well, even if they don't cook it well, you can still manage it. It's one of those things. That's one of those foods that we are able to take whichever way and format you find it. So I enjoy gobe a lot, but I eat anything and everything. I the During the last exam, I went to Keta, and I think for the 3 days I was there, every lunch I ate akple and fitiri, and it was, I mean, it was nice. Though I've eaten some before, I mean, many times, but that particular one I had at Keta, I don't know what they put in it. Maybe I have probably have eaten dog meat. I don't know because I eat a lot of kebab, and sometimes they say the kebab no is they add it with they use dog meat. I am not sure. I don't know. Okay, but please, when I come, Carl, I did not enjoy red banku. Maybe you can help me get some. Mm? And taste it. So that is me. And I support two teams in this world. Two teams. I sympathize with some others, but my two main teams are Kotoko. And I am not Kotoko because I am an Ashanti. Okay. I like their resilience. I like their bravery. The two teams, actually. I like our resilience and our bravery. We are only the two teams that we will lose and still be happy about it. Okay. The others, when they lose, they start crying all over. Eh, they start crying all over. But Chelsea and Kotoko, losing is part of us. We can lose, and we lose at the games you expect us to win. You see. And so we are very resilient people, the supporters. We are very resilient. I know many Arsenal supporters who are not Arsenal supporters again. Uh, if you support Madrid, if I were you, I wouldn't even say it. Eh? You make noise. But if I ask which team for the next 3 years is the champions of this world, you cannot mention any other team but Chelsea. So, hey, Arsenal fan, you get hurt. Hey, wow. Anyway, but I am a red and blue person. Red and blue. Okay. So when we win, I am happy. When we lose, I am still happy because Chelsea is Chelsea. Okay. But the other teams, uh, in fact, I don't know why you support Arsenal. Which people? Um, the Mami U team. I don't know why. They will say it's their season, but at the end of the day, the season doesn't season for them. And another team will come and take the the trophy and go. Eh? They've been saying it for that long. But hey, if you don't have any team, please, I am here. Join us, the Blues. and Kotoko. I sympathize with Barca, Liverpool, okay, um, not Real Madrid because, well, I don't like Zero that much. I prefer Messi. It is your my preference and your preference. Take your own. Let me take my own. Okay, this one is no fighting. If Chelsea is a women's club, I don't know what Mami U is. A team that is called Mami U. Eh? A team that is called Mami U. We change managers because we want the best. That is all. If you are there, you are misbehaving, we will let you go. Mm, it is as simple as that. Why would you keep somebody who is not helping the team? At the moment, they say that the manager should go. Please, he is gone. We'll get a new manager. Life is like that. Some go, some come. Some win, some lose. Mm, but um, please, I am Chelsea. Nothing you will say. We can lose and come, eh? I will still say I am Chelsea. In fact, when we lose, that's when I make the most noise. Mm. It is a coping mechanism. So that's now fans. Hey, all the best to you. Now let's quickly establish a few ground rules. All right. Establish a few ground rules and then um oh, he wasn't bad. Yes, he wasn't, but at the moment he's not serving our purpose. So we have let him go. We will get new one. Okay. A few ground rules. Be punctual in on time. So usually I allow 5 minutes and then I start my lectures. So please be punctual so that we can have lectures on time. Put your phone on silent mode, do not disturb those who are using their phones. I don't encourage you to use your phones because what will happen is that whilst you are having lectures, notifications will be popping up, WhatsApp, Facebook, TikTok, Instagram, and then you'll be tempted to go and look at it. And whilst you are going to look at it, mm, whilst you are going to look at it, but are you not called Mami you? Which one sounds better? Man you and Mami you. I think Mami you sounds better. Okay. Anyway, so let's get tablets. If you can't afford a laptop or a desktop right now, at least you can get a tablet that you can use. Okay, so that um uh, you don't get distracted with these things. Sometimes you be in class and a call will come through. It will take you off the Zoom. You have to join again and you will miss something. Okay, so let's try as much as possible to um, avoid the distractions. Respect, I've talked about that. And I always like feedback. If I am going too fast, which I have a tendency to do, please draw my attention. Madam, please, can you slow down? Okay. One of the best ways I used to get I like using to get feedback and to get students to attend lectures. Some of you have the notes already because you know someone who has given you the notes. I do edit my notes, I add, I subtract all the time. I will encourage you to use what I will give you. Okay. But one of the things I like doing is doing in-class tests because usually uh I would announce the test. But what I realized is that people will come and say, Madam, we did not see and we didn't do this. But you have a responsibility to come for lectures. Okay. And so this time around, I'll do a couple of in-class tests. That is my way of getting feedback. That's my way of getting feedback. And so I would encourage everyone to attend lectures. Um, Once as we are going, I'll ask, do you understand? Give me feedback. Don't keep quiet. Because if you don't, you don't. Okay, so I encourage you to read ahead, get some questions, come share your experiences so that the class will be interactive. Then we may have one or two assignments. Please make sure you take part and submit on time. Avoid distractions. Okay? Avoid distractions. You see, some of us currently we are at home. Some of us are mothers, fathers, aunties, uncles. We are taking care of our sick parents and all of that. Please, when it's time for lectures, you see that is the time the children in the house, they are fighting, and you have to go and separate fights. So please, let them understand that from this time to this time, I'm having lectures. In between the lectures, I will have time for you. And make sure you have the time for them. Okay? So, if need be, do not sit at a place where you know they would disturb you. Look for a place where you know the network is good and there will not be much disturbance from your household, okay, so that you can concentrate. Be prepared and come to class. Raise your hand if you want to talk. Keep your phones muted even when we have not muted you from here, okay? Stop multitasking. Me, I have joined a lot of Zoom lectures. I have joined a lot of Zoom workshops. Sometimes I am cooking and I am doing it. It is not the best because you tend to miss a lot when you multitask. Okay? So if you go cry, they'll follow you. So sometimes when I know that the meeting I'm going into is important, I have kids. Okay? It's not that they're a bit grown, but my last one is 9 years. She's very clingy. I can be, currently I'm not at home, but most of the time, if I'm having lectures, she's sitting beside me, but I ask her to keep quiet. I get her something to do. Okay. So find a place where you let them know that this place is a no distraction zone. It's a safe zone for me. When I sit here, it will amaze you. The kids, they understand. Okay. So let them understand. Some of them as young as 1 year, 2 years, if you are insistent and you work on it, they would understand. Mm. And make sure you give them what they need before you go and sit down to have your lectures. Okay. So avoid multitasking. Sometimes you are here. Some of us, we are lucky, we are using laptops. At the same time, we are on Facebook, we are on TikTok. It won't help you. Use the chat feature to help you. So if I am teaching, I'll give opportunity to ask questions. So right now, let me start this. Write your expectations, your likes and dislikes. I've shared some of mine already. So go to the chat, type your expectations, your likes, your dislikes. Put it in there for me so that I pick up on it. Now, the names. If you go to the list right now, participants, and you look at it, quite a number of you have been able to sign in with your full name and your index number. But I'm sure earlier on, yes, some of us is only our first names. Some of us is our nicknames. Some of us is the phone, Zoom user TechnoSpark 7. There's no way if you raise your hand. We are not, we are in a professional setting right now. And so if you come in and you want to raise your hand and your name there is Zoom user. Trust you me, I cannot call a human being God has created a Zoom user. Everything God created has a name. It has a name. The right name. There's no way you go and call a snake yeah. Unless maybe it's your pet and you want to name it yeah. But even that, I don't think I've heard. A snake is a snake. And a human being is a human being with a name. So let's respect ourselves and put in the name. Okay. All you have to do, you see, if you go to the participants, you see three dots against it. Click on that three dots. You see rename. Then you type in your name and index number. From the third week, anybody I see without a name, an index number, I will remove you. Let's be clear, because I know people share our links, all right? Our links with other students from other schools because they are not getting what they paid for. And so they come in here and then join the class. That is not appropriate. So from next week, sorry, from the third week, this is first week, second week, third week, any name I see for both courses with that does not have the name and index number, I'll remove you. Okay? I'll remove you. You have to register before Uncle Callistus. You have to register. If you get admission, you can't wait till the end of the semester to register. Once you get admission, the first thing is that you pay your fees and you register. You don't need to pay full fees. The university has given room for what do you call it? Room for uh payments models. Okay. So please, this is not an excuse. There's a payment plan. You need to do 50%. Once you do 50%, you can register. Then subsequently, you pay the rest. So please, it is not an excuse. Some are saying you don't have admission, then you are not supposed to be here. You are not a student. That's why I'm giving up to the third week. By the third week, mm, by the third week, everybody should have received their index number and then registered. Your admission is done. I know most of you, you have admission. Some of you, you are just waiting for. You want to wait at, I don't know when you want to pay. So please, with all, I mean, let's respect ourselves. Okay, let's respect ourselves. In as much as we are here, that's why I'm giving you that room, 3 weeks. After the third week, any name I see that does not have index number and name attached to it, off. And I know our index number, so you cannot go and pick any set of numbers at all and come and put it there as what? Index, your index number. Let's agree on this. 3 weeks, 3 weekends. After that, Zoom user, Spark one and one now, Techno one and one now, iPhone. You are not the only people using iPhone, so iPhone is not a name. Techno is not a name. Okay. All right. Let's quickly move on. Avoid distractions. I've talked about most of these already. One thing I will talk about, you see, adult education is not easy. I've gone through it. It is not easy at all. So I understand some of the challenges we all may have. Okay? We all may have. But you can do something about it. So get yourself a personal timetable and stick to the timetable. Sometimes you don't need 2 hours to sit down and learn. We don't have 2 hours. Even that 2 hours, you'll be sleeping. Mm? That 2 hours, you sleep. Stick to short periods of learning. When you are growing, your concentration reduces. You are not able to concentrate because there are a lot of things clamoring for your attention. So do not put it there. I'll study Please, you will not get. And out of the 2 hours, the time you actually even study, no, will be what? Like 20 minutes. Some of us, our attention, our concentration is only 10 minutes. And that is the time you have to use to study. Know the time that personally, if you are very good at learning, I mean, when you learn, it takes. So if it is early mornings, then that is the times that you have to learn. If it is late in the afternoon, that is the time you have to learn. So you yourself, you should know when is good for you to study. Okay? Then take short breaks. So maybe you'd say, I will learn 1 hour every day. Don't sit down for 1 hour. Break it into pieces. Maybe 15 minutes, you learn, get up 5 minutes, 10 minutes, come back again, learn another 15 minutes. That takes better than you sitting down 2 hours to learn. It doesn't help anybody. Okay? All right. Um, then attend lectures all the time. Keep notes. Okay? Take notes. Network. You see, earlier on, I asked that you tell me where you are joining from. Some of us, we all live in Takrady. We don't know that we are all in Takrady. One other activity I may ask you to do, getting some after this one, will be to tell me the facilities that you are. You realize that, oh, Akosia and Ya are in the same facility. It can help you form study groups, okay, or study buddies, so that you encourage each other to study. Another thing that you can do for the networking, if you find yourself in any of the towns, trust me, if you know one colleague is there, um, okay, um, you would it will make it easier for you. Make friends, all right? Study together, be a buddy, form group studies. I mean, don't the group shouldn't be a lot of people. When you put a lot of people in a group, it makes learning difficult. Okay, okay. So just study in groups, maybe maximum 5, 6 groups, minimum 3 people in a group, and then you stick to particular times where you come together and study. Please, being in a group does not mean that you will not have your personal time or study. Some people, they only study when it is group meeting. If there are a lot of people in the group, you end up joking instead of studying. Okay, so don't study with people you know will not help you. Your friends, you know the person's suban already. You know their character. You know their behavior. They are not serious. They are not the people you have to be in a group with. Okay. All right. So your likes and expectations. Let me go to the charts. I've seen a lot of you type it. Some want interactive lessons. Um, Steven is looking for a steady buddy, I think. He's in Takrady. Please link up with him, Steven Youngson. So the expectations to get more insights of the courses, definitely apply it. Definitely. I like this. Jessica likes food, listening to music and learning new things. I am happy because you learn new things. Let me start from the beginning. I read just a few. somebody said she does not like insults. Emmanuel, please, nobody likes insult. I personally don't like it as well. So I don't expect you to insult anybody, and nobody would also insult you. Okay. Emmanuel Chumesi also says again, I expect cool and friendly relationship, definitely. Lively lectures, definitely. You will get the slides. As for the slides, the I will send them and you will say that, Madam, is enough. Once I take you through the course outline, I've done 60% of my job. If I give you the slides, I've done 80%. The 20% is just to come to class and then um explain certain things to you. Some of us are slow learners. From Peter, will be asking questions. Please, don't worry, I don't get annoyed at all. We would all see. I am one, I don't easily get annoyed. I am not that type of person, personally. Some say you want to get the lecture notes. As for the notes, trust me, you will beg me and say that, Madam, is too much. You will get it. There was someone who said, um, yes, they dislike people. Ivy says, she dislikes people who undermine other people. Yes, and thank you. I like you already. Me, I like everybody. I don't know anybody I hate in this world. I don't think it's possible for me to hate anybody. Okay. And someone says I should tell them before. Mm, if there is going to be a lecture. Yes, definitely. There is going to be a lecture, a quiz. I will let you know. If for some reason I don't usually miss lectures, but if for some reason I have to miss lectures, definitely I would also let you know. People are asking for study buddies. They have put their information there. Okay. Someone says she dislikes long talk or lectures. Hey, Reggie, I don't understand you. You dislike long talk or lectures. Every lecture is 2 hours, or 2 hours is not long. Or the long talk, which long talk are you talking about? Okay, please, as for lectures, you cannot dislike it. You have to attend all of it. Mm. You have to attend all of it, please. You cannot dislike lectures, please. This one, dear, I beg you. Mm, you, Madam Businessman, a businesswoman. uh, Esther is looking for a steady body because she's a businesswoman. Anyway, um, the steady group long talk. Ah, okay. I hear you. Please, my greatest expectation. Somebody says I don't like referrals. Personally, I don't like referrals as well. Because you see, you need only 40%. Continuous assessment is 30%. That means that you only need 10% from exams to add to the 40. You know that you cannot get all 30, but at least some 20 you should target for continuous assessment. Okay. And so exams, you should target another 20, and add and get your 40 and go. But some of us, we won't learn, we won't take part in any quiz, we won't take part in any exam, we won't do anything, and you expect to pass. How is that possible? Hmm? How is that possible? Grace says, I expect areas from the lecture notes prior to exams. Please, everything, I'm saying it today, everything I teach will be part of the exam. There is no areas. I can't divide the human body into different parts and say I'm giving you only questions on the head or the stomach. No, it's a human being I am working with, and so every part is part. And I tend to do a lot more of basic pharmacology, because at your NTC level, and because you are working, you know most of the drugs that are used for the various conditions. Yes, we'll talk about a few of them, but I tend to spend more time on the basic principles of pharmacology, pharmacokinetics, pharmacodynamics. We look at the theories and all of that. Okay, so I expect that you will be able to at least get your pass mark of 40 and go so that you don't give me extra work. Because refer, mm, if you refer, you would give me extra work. I hope you know that. Referrals bring extra work to lecturers. If you don't know, I am telling you. No lecturer is happy when people refer at all. So I also don't like referrals. But if you don't get what you need to at least get and you have to, uh, please, why would the lecturer intentionally refer students? Please answer the question for me. Hmm? Lecturers don't intentionally. Why do they know you? When they refer you, what would they gain? It is actually extra work because when you are referred, we have to set questions and mark. So why would I waste my time when uh, at least I can help you get your 40%? You attend lectures, you pay attention during lectures, take part in quizzes, exams, assignments, learn, write the exam. I mean, how? But some of us, we will do all of this, and in the exam we just finished. Over 70, somebody gets 5 over 70. How much will this person get from continuous assessment that we will add? So definitely, this person is going to fail because let's assume you even get 30 over 30 for continuous assessment. In the exam, you are getting 5. Isn't that 35? Where do you want me to get the 5 from? And to get 5 to add, you have no idea what it takes. So please, do your part. We'll also do our part. Nobody intentionally fail anybody. Mm? Nobody. Because it's extra work. Whilst people are enjoying their holidays, you are setting questions. So please, to end here for now, if you have any questions, anything you would want to know, like I said, people are already getting in touch, connecting. The Tamale people are connecting. Atonso Agogo people are connecting. Cape Coast people are connecting. Accra people are already connecting. Go to the chat. You see, someone is in Atebubu. Someone is in Kwame Danso. They are connecting. Okay? So please, put yours there. You will get a steady partner. Okay? So all the expectations are also my expectations. I understand. I had 2 children under 2 years when I was doing my master's. I had a third one when I was doing my PhD. So I understand. Okay? I understand. Please, I also do you to understand the fact that you are um, a mother, also that is not an excuse not to learn. Mm? It's not an excuse not to learn. So learn. Come to class. Some of us, even today, we are missing. Some of us, we are already missing. Please, people are sharing where they are staying, they are not. Please do some. Mm? Okay, so to end here, keep calm, study hard, pray hard, and do your best. Okay? And my prayer for us this semester is that God will give us peace and calm to our minds as we study. Help us to manage our stress and anxiety, and then also to approach our work with a clear and tranquil heart. And may His peace that surpasses all understanding guard our thoughts so that we can end the semester and the program well. But in all of it, don't forget to have fun. Have fun. Fun is good. all work and no play, make Jack a dull boy. How old I am? Me, I'm not the type of people who hide their age. I am turning 42 very soon. I am old. Okay, somebody asked me, I don't hide my age because I think I look younger than my age. So I always want to boast about my age. All right. So, we will end for now. Uh, Here, you can ask if you have any questions, you can ask. I saw a hand up. Is it down? Okay. Linda, please unmute whilst I share the next section. Linda, or say your hand is up. Yes, sorry, unmute. After that, Peter will come in. Okay, go ahead, Linda.
My phone fell, so it turns on the raise hand. Sorry, please.
Okay, all right. So you don't have any comment or any question. Is that it?
No, guys, I'm not
Okay,
sure. Thank
all right.
you.
So thank you very much. It's good to hear your voice. Um, Peter, Peter on mute.
Hello, madam. Good morning.
Good morning.
Thank you very much. You've really boost our morale for this program,
Thank
and
you.
and God really bless you. My question is, some of us at the chiefs level,
Mm-hmm.
and this program, we need so many things for us to go higher, and
Mm-hmm.
there are some people at the hospitals. Like when lectures start, like you at the chips level, there are so many things we don't do, or so many that we don't know. So when the explanation is coming, you are asking question, they should please give us some chance
Okay.
for us to ask questions so that we will get the concept. Thank you very much.
Okay. All right. Well noted. And this is to all of us. Okay. It's to all of us. Some of us, we have the opportunity to work in bigger facilities, have access to a lot of things which others do not have. And so please, when it is time for them to ask questions, let's be kind. Okay. All right. Thank you very much, Peter. Well noted. Okay, so there's another hand up. All right, just a moment. Emmanuel, hey, your Emmanuel is with an I. Please, you can unmute.
Yeah, so I wanted to make I want thank you very much for the opportunity. I wanted to ask a question that what at what month is the first semester ending actually? Thank you.
Okay, so the first semester will end in May. You are likely, I have to confirm on the academic calendar, but you are likely to start exams um, after Easter. And so you end the semester likely early May. That's the time it usually ends. Yes. Caleb, please unmute. We'll take three more from Sandra, Sewa, Linda again. All right. So Caleb, go ahead.
Madam, good morning.
Good morning.
I want to ask that our class score, I hope it will be given to us before the end of semester so that we know our score before we enter the exams for, or it's not like that.
As in continuous assessment score.
Yeah.
That's I cannot really assure because we do a couple of quizzes and some assignments. You may not have submitted the assignments as at the time of the exams because we have to ask for the assignment hard copy. So we would have to take the assignment and score. But at least the quizzes, you know what you did. If we agree to do an exam for mid-sem, you'd also know your score because it will be done on the V class. So you know
Okay.
your score,
Okay.
okay? But
Okay.
the continuous assessment is 30% of all of it. You see,
Okay.
30% of all the exam, the quizzes, assignments, and all those things. So you may not know all of it. As for that, I cannot assure that. But if you're able to do everything, yes, why not? You can know.
Okay, madam.
Sandra, please unmute. Sandra Boating, unmute, please. Okay, let's go to Sewa. Sewa, please unmute.
Okay, please, good morning.
Good morning.
Please, I wanted to know the type of exams question that we should expect. Is it multiple choice, true or false, or short answers essay?
Okay, great. Thank you for your question. So I do only objective questions. Objective questions. Objective questions meaning that you are going to have MCQs, most appropriate answer questions. That means you may have usually four options, you choose one. I do variety of true or false. So they can be simple true or false or assertion and reason. I do multiple completion. They are all objective. Okay. Arrangements. Matching. So we will try all of it. Okay, we'll try you. That's why we do the quizzes, short quizzes, like 5 questions, 6 questions. Some can even be just 3 questions, just to see the kind of questions that we would have. Okay, one thing I would encourage all of us to do is that we prepare because I am going to give you the notes. In fact, this week, that is one of the things on my task list. I'm going to upload the notes on the V class. I would also share it on the Telegram page. The textbooks will be given to you. I expect that you read. If you read before you come, we'll spend less time as in teaching, giving. And we'll have an interactive class. We would share experiences, and that one usually helps with the learning. Okay, that helps with the learning. So please, I'll show you the kind of questions I have, I set, but I don't do essays. No essays, no short answers. You do calculations because as nurses and as students learning pharmacology, you are definitely going to do some dosage calculations. For theoretical foundations, no theory as well. Same, similar kind of questions. So please, no essays at all, at all. No, I don't think even theoretical foundations will do short answers. Maybe matching, but I don't do essays. Okay. All right. Last one, because Sandra couldn't answer. Sarah, please, you can unmute. Then I would quickly
Okay.
share. We'll do the course intro. We just have a few minutes left. Sandra, please go ahead.
Sarah, please, I wanted to ask if we are going to be informed concerning days we are going to do class tests and then make sense. And I wanted to ask
Mm,
if we will be informed prior to our make sense and test.
sure. So midterms, we will decide together the dates and everything. We have a midterm week, okay? Um, on the academic calendar. I'll share the academic calendar with you. And so there is the midterm week. If we agree to do a midterm, then it will be done in that week. If we agree to do an assignment, then we will agree on the time you are supposed to submit the assignment. For the quizzes, is both announced and unannounced. The reason why I do both announced and unannounced is that experience has taught me that if I don't do some of these unannounced quizzes, some of us we will attend only lectures during announced quizzes. We won't attend the rest of the lectures. So I am saying it from today. Announced and unannounced quizzes. Yes. Thank you very much. I think there was one more hand. We'll take the last person. Gifty, please unmute.
Okay, please, good morning.
Good morning.
Please, I'm trying to ask a question. We've joined August batch. So I'm trying to ask that, are we going to continue with them, or we'll do another lectures when they vacate, please?
Okay. So what we have been doing the past few years is that after this semester, during the long vacation is from May to August. During that period, you have your second semester. Whilst they are on vacation, you have your second semester. And then when school reopens in September, late August, September, you join them for level 400. And there have been some discussions for you to run your own course. I don't know, but that is what we have been doing. And so you have your second semester during the long vacation, and then you have your first semester when we all return back to school from the middle or end of August. Yeah,
Thank you very much.
you are welcome. So I believe that was the end of the questions. If there is anything, the department would duly inform you. Okay. All right. So this is the course intro. The course outlines will be shared with you on the Telegram platform. But when you get it, it contains almost everything, except a few things that I'm not sharing on these slides. Please continue to share wherever you are with your numbers. People are doing it, and trust me, you see how it will help them. You stay there and don't do some. Anyway, so two courses, pharmacology therapeutics and pharmacovigilance. That's NURS 232, 323, Theoretical Foundations of Nursing, NURS 319. I'm going to be your facilitator. Please, my number is here. My email address is here. You can reach me 8 a.m. to 5 p.m. If I don't answer, it is not intentional, please. If I don't answer, it is not intentional. Yes, I am a fellow of the Ghana College of Nurses and Midwives. I am an elected fellow. Okay. All right. So you can reach me on these between this time, 8 a.m. to 5 p.m. Please don't call me outside these working hours. You can send me a WhatsApp or a Telegram message or an email or a text anytime. I would respond as soon as I see it. Trust you me. If you send a message and I don't respond immediately, you see, right now I am in class, I am teaching. So if any message that has come, any calls that I have come, I have seen on my phone, I cannot leave the class to go and answer. And we teach during the week. We have meetings and all of that. So when you call at a particular time, within this time, and I don't answer, trust you me, I will call you back I'll respond to your messages. Okay. All right. You can follow me on LinkedIn. I am on LinkedIn. This is the link. You can follow me there. About the courses, please, don't take life so serious. You see how the other man is carrying books, struggling. Please, life is not like that. Okay. Attend lectures, um, and learn small, small. And trust you me, you'll be able to make it. All right. So for pharmacology, we are going to look at the basic principles of pharmacology, where we'll talk about pharmacokinetics, pharmacodynamics, pharmacotherapeutics, and then we'll look at pharmacovigilance. Basically, we are going to talk about medications, how they interact with the human body, what the responses of the human body is, how the type of therapies that we have, and what are the considerations that you have to take when it comes to medications. We'll talk about drug administration, and you know about the nursing process already. Um, so we'll link drug administration with the nursing process. We'll do dosage calculations. Um, uh, we'll look at dosage calculations. We'll look at how to calculate quantity, volume, IV fluid flow rate, pediatric calculations. We'll look at the do's and don'ts of drug administration. We'll look at the rights of drug administration and all of that. And then we'll talk about pharmacovigilance, what we need to do as nurses to make sure that our patients, when they experience side effects, adverse reaction, is well reported. Okay, we have a lot to talk about, a lot. And so please, when I share the notes, please spend time to go through it, because we are meeting 2 hours each for pharmacology, 2 hours for theories. Theories, the content is not too much, and so we may, end up finishing early. But for pharmacology, the content is a lot. We will not finish all of it, okay? But we'll do our best. So that is about that. My overall goal for pharmacology is that you'll be able to know the effects of drugs on client's body and the effects of the drug the client's body has on the effects the client's body has on the drugs. That's pharmacology, pharmacokinetics, pharmacodynamics. We would also look at the knowledge um, on the uses and administration of some medications and the nursing implications. And then also is my goal to mold you to become safe and skillful administrators of medications and astute observers of the drug effects on your patient or your clients. These are the course outlines. They are in your notes already. The objectives are in your notes. I would encourage you to download these apps if you are um using a phone. Even if you cannot get yourself a tablet, I would encourage you to get yourself another phone where you use that one for only lectures, so that people that do not know that number and will not be calling you on it. If you are using the phone or the tablet or even a laptop, please, these are some apps that will help you. Get Telegram, because that's where we share the notes. Get yourself Zoom. Finis will help you. Finis, Adobe, WPS Office Suite will help you to read some of the slides. Some of the slides have voice recording that I've done over it. And so it will help you to listen and to read it as a slide, okay, to read the slides. Medscape is an app that has over, I don't know the number of medications it has. Right now, if you don't have Medscape, just go to the Google Play Store or go to the App Store and download this app. It's free. You just have to register for it. You go through the account setup. It will ask you a few questions. Please, it will help you not just for the course, but is for your work as a nurse. Okay, so it has a lot of drugs. You can use it to get information about drugs, any information at all. It can even help you identify a pill or a tablet if you don't know it, if you don't have information, if you describe it, it can help you identify it. It has information on procedures, clinical procedures. I mean, a lot of things, new medications that are coming up, the ones they are taking off the markets. I mean, they share articles. There's a lot you can get from it. Okay, so please download it now. Download it now. If um you have not used it before, please. This is an app I expect all of you to have. You can keep it on your phone, you can keep it on your laptop. It can even be used offline. There are parts of it that you can have access to it offline if you don't have internet. Okay, so I encourage you to get that. For theoretical foundations, this is our objectives. We will define what a nursing theory is. We will look at the types. We will look at the relationship between the theories and the nursing process and client needs. We'll look at the historical development of theories. We'll look at the selected theories. We'll discuss them and look at knowledge development in nursing. We'll discuss the nursing meta paradigm as well. These are some of the theories we are going to discuss. There are over 100 theories, just nursing theories alone. There are over 100. If I am putting you for now, I see 200, let's say you are 280. If I am putting you in groups of even 5, I will get a group, a theory for each group. Okay, I'll get a theory for each group. Trust me, there are so many theories. These are the very common ones. These ones are the very common ones. Florence Nightingale's environmental theory, I guess, is the most common. Okay, but there are new theories which usually we don't tend to use, but trust you me, I will give you a list of theories that you can read and apply at your own time. So this brings us to the end. The course outline, the reason why I did not go through step by step is that I want you to read the course outline. Okay, so I'll share the course outline on the Telegram page. But usually when I share any document, I would make the settings such that for about 24 to say 48 hours, depending on when I check, I see a lot of people have seen it. You cannot comment on the page. So when you see I've done something like that, it's because I've shared a document that I want everyone to see. Okay, so this brings us to the end of the introduction of the courses, getting to know each other. If you have any questions, we have some 8 minutes left. Please, you have any questions, today is the day you ask them. From next week, God willing, we are going straight into learning. We are meeting on Friday, 3 to 5 p.m. 3 to 5 p.m. Please don't come at 3:30. Don't come at 4:30. Okay? On Saturday, 7 a.m. to 9 a.m. Please be on time. Be on time. How you start will determine how you will end. If you start and you are always coming in late, trust me, the whole semester you are going to be late. We will not wait for anybody. Like I said, when I join, I'll give 5 minutes after the time we are supposed to start. So from 3, I used to do 10 minutes, but I realized that people were taking advantage of that. And so now 5 minutes. 3:05, I start. Anytime you join, you join. You can't tell us to go back. Wherever you join, you join. When we finish, because we are recording, when we are done, you can easily, I'll share the recording I just realized this one, I did not record, but I'll share the slides on the page. And then the recording will be shared with you. I'll get the IT unit to get me the recording. It will be shared to you on your Telegram page. And then please, when you miss like 30 minutes, 1 hour, don't come back and say, Madam, please, can you go back? No, we go forward. So we will go forward. When we are done, you can always go back and then uh, review the recording to learn what you missed. Any question? Any question? People are forming the groups, and I'm happy about that. Okay. All right. Yes, Glover, please unmute.
Well, good morning.
Good morning.
Good morning, everyone. Yeah, sister, yeah, please. There's this question I just want to. I think it's a follow-up question to one question a lady asked concerning
Okay.
the exact month, and the year the whole course will come to an end. That's what I want to know. The exact
Well,
month and the year the whole course comes to an end.
well, so like I said, it's a 4-semester course. 4 semester typically means 2 years. So ideally, you are to finish this program. So you are supposed to have this semester, you have a break, come back, have another semester. Every year, you have 2 semesters. Okay. Now, what we have been doing previously, which
All right.
is being reviewed, is that for those admitted in January, they have 3 semesters in 1 year. Please, I hope you are following. So if they have
Exactly.
3 semesters in 1 year, it means that you have another semester during the long vacation. Then you have your third semester from September to December. And then your last semester next year, 2027, from January to June. However, there's been some discussions around it. So if that is so, then this year you have only 2 semesters. And the next year you have 2 semesters. Whichever way, you will
Okay.
finish 2027, either in May or December.
Okay.
Please, I hope you understand.
Yes, please. I do.
Good.
But I think
Is that
personally I
all?
prefer the first indication you illustrated.
Which one? It is not
One you said
it is
will be
not a
all right.
decision, the 3 semesters in 1 year.
Yes, please.
Well, it is not a decision to be taken by me
All right.
or even the department about it. So, but whichever way, 2027, you'll be done. I
Okay.
guess
Thank you
that
so
is the
much.
most important thing. By 2027,
Yeah.
you'll be done. either in May or December. The difference is not much, you see. All right. Let me take one more. The last one from Gifty again.
Sister, yeah, please. I maybe this one there, because we are the student, I think we should have vote and we will choose this thing, because some of us we prefer the May.
You see, like I said, it is what we have been doing. The university is accredited by institutions, GTech, NMC. We also have to answer to them. So if they ask us to do something and we don't do it, it's your certificate that is at risk. Sister Gifty, do you understand?
Yes, please.
Mm-hmm.
But some
I
of us
am
we
not
had the same.
saying, please, I don't want you to get me wrong.
Okay.
Please. I am not saying that is we are going to do something different. I am saying that what we have been doing for the January cohort is 3 semesters in 1 year. So like this year, you have 3 semesters. There have been concerns raised by GTech, NMC. I don't know what they are saying. I am not the current HOD, but I know there have been discussions. I cannot tell you what the final outcome is here right now. That's why I'm saying that this is what we have been doing. Even if there is going to be any change, you will still finish in 2027. Just that it will be 3 or 4 months later. That's all.
Okay.
Please give tea.
Okay, thank you.
Thank you very much. Don't go
Okay.
and misquote me anywhere, please.
Okay.
All of us. Don't go and misquote me anywhere. Okay. Thank you. Madam Linda, your hand is up. I hope this time you have something to say. Our time is up. I may have to end it here. But you can bring your questions on the page, on the Telegram page, and I will gladly answer you. Okay? So I would want us to end here. God willing, next week, Friday, if Christ has not come, we would meet. Thank you very much for joining me. I hope you enjoy the rest of the weekend lectures and have a blessed week. God bless you all. Bye.